give us your name and who you represent.
My name is Dr. Robert Marks, and I'm a pain management, I represent 28 million Texas patients, which include all of you, all of us, everybody behind me, as well as the Lieutenant Governor and Governor, because all of us might need this one day. To be clear, I have zero financial interest in cannabis in the state of Texas. I could care less if this is legalized from a personal standpoint. I'm dual board certified in both pain management as well as anesthesiology. I practice exclusively pain here in Austin. And I'm here after canceling procedures here, moving things over to the afternoon, moving a flight out, upsetting my wife, etc., because I feel a very strong ethical duty, an ethical obligation toward my patients and every other patient in this state, really in the country, to do what's right. And part of the Hippocratic Oath, and I know some of you guys have taken that oath, you guys have also taken oaths of office, is to do what is in the best interest of your constituents, of our patients. And we have a doctor-patient relationship that is imperative. Patients are bringing cannabis in from out of state, whether we like it or not. It happens all the time. People are reading about this. It's everywhere. And patients are asking us questions. And the importance for physicians to be able to communicate with their patients and utilize this in cases where there is no safe or viable option is critical. When we look at how to perform the practice of medicine, we always have to evaluate the risk to benefit ratio. And that's when you weigh how risky is something and what is the potential benefit. Now, I recognize and I respect that there may not be a satisfactory degree of research for certain indications that you guys may or may not want on this bill. PTSD is a great example of this. The risks compared to the benefits with medical cannabis for PTSD is exceedingly clear. But we have other patients too, and this is a reason that the doctor-patient relationship needs to incorporate the ability to be able to choose indications. I have a patient that's dying of Wilson's disease. Who's heard of Wilson's disease?
Can we grab for some, please?
Yes. The bottom line is I really very sincerely want to ask you guys, and I mean this with the utmost respect, you guys need to do your jobs. Think ethically.
Thank you very much.
You guys know you support this legislation. You have a lot of pressure to not support this
Senator
legislation.
Menendez.
Mr. Chairman, very quickly, you made a very passionate, appreciated speech, but the question is, as a pain specialist, you have the federal government on your back constantly. Your patients have to come in and they have to test for illegal drugs before you can prescribe them pain management drugs. Is that not correct?
That is correct.
Okay. So you can't, when they come in from visiting other states or trying to give medicines, if they test positive for something that's illegal, then you may not be able to treat them. Is that correct?
It happens all the time. Most of our patients are not on opioids, thank goodness.
Right.
But you are exactly right, and it is a huge problem, and it's not just with opioids. I see very many geriatric patients actually that go summer in Colorado, and they come back and they try topicals. They get fired from other pain doctors.
They get fired.
And it's not just opioids though. It's Lyrica. It's certain seizure medications. It's ADD medications.
They get fired from regular medicines because they've tried THC in a legal state. Is that not correct?
That is exactly right.
That's a problem that we have in this state that we can't resolve. Dr. Campbell's original bill spoke to that by not creating these problems. Thank you for your testimony.
I consider this, I really truly consider this to be, I refer to it as a cannabis crisis in healthcare. It
Thank
is
you.
truly affecting
Senator Campbell.
healthcare.
Thank you so much. I appreciate your testimony. It's always nice to have the other physicians. Things can't get passed with just one vote. You need a body, and it's a deliberative body thinking, and we're trying to make sure there aren't unintended consequences. So I appreciate your testimony, and anybody who watches a football game, they're going to root for their team and be happy when they at least get a first down. So I appreciate your support. We would like to be able to include so many more diagnoses. This is most certainly a more expanded list, and we will keep working with this. So I appreciate it, and the last comment that we'll have is thank you for your service. Thank you, Mr. Chairman.
Thank you, Senator. Any other questions for this witness? Thank you all for joining us today.
Thank you all.
Thank you.